This podcast represents the opinions of Katie Allen, PA, and guests of her show. The content is for informational purposes only and in no way sets up a patient relationship. Consult your healthcare professional for any medical questions. Now, here's Katie Allen.
So glad that you guys could join us on Make Me Pretty podcast. This is your host, Katie Allen, and I have a lovely guest today, Gentry Hunt, who is a nurse who has a master's in nursing with a specialty in maternal newborn care and a list of things that she's been involved with and done and directs over and takes care of that could go on, and I'll have that listed. Welcome, Gentry.
Thank you.
We have a special topic that is one that oftentimes gets neglected, and that is the postpartum period after you've gone through the 9+ months of hell. No, I'm just kidding. It depends on your thinking of it. But a pregnancy, where you get this joyous thing called a baby. You know, we like to think of it like a book or the movie, and they wrap that little baby up with something blue or something pink. They deliver it to you, take them home, and it's all as well. And you live happily ever after. But that's not the way it always goes. In fact, it's rare that it goes that way for all kinds of reasons. So we're going to talk to Gentry about this and things that have been done in the past, and then how they're changing, and what some goals are, what they're planning to do. But just speaking about the postpartum time frame, specifically with America, the postpartum period. What do you think when we say postpartum? We're talking about really after delivery. What happens kind of after delivery? What does that look like? Some of us have experienced it, but
Yes.
really not always. It's always different. So
you're going to come into labor and delivery, have your baby. If all goes well, your baby will come to postpartum unit with you, where you will stay usually 24 to 72 hours, depending on if you had a vaginal or a C-section birth. And during that very short period of time, you are told a lot of things to try to accomplish and do, and
just like that.
Yes. And so it seems so simple, but it is a very, very overwhelming time. You have all these hormonal shifts, and
you may have just had surgery.
Yes, may have had abdominal surgery.
Or what did you say? Pushed a human?
Yes, pushed a human out. So, that's a big deal. Let's be honest. So in that short period of time, you are giving just an abundance of education, and it's hard to absorb all of that. So once you transition home, you have all of the things, you're trying to get rest. You may or may not have other children that you're trying to take care of.
You may or may not have a support system.
Yes. Whether you have a support system or not, all of it is challenging. In America in general, we have a pressure to return to work much quicker than a lot of other countries. We're only one of 7 in the world that don't have.
So you're supposed to deliver a baby,
yes,
which could be basically surgery or push a human out of your body. You're supposed to return home, figure out how to, if it's your first one, care for this human, or say you may or may not have a good support system.
Yep.
And then somehow you're supposed to get some rest while this little human is requiring a lot, while you're lacking sleep and that hormonal shift.
Yeah. So somebody's gotta clean up, somebody's gotta do laundry, somebody's gotta feed the other children. I think one thing that's overlooked so often is the importance of proper nutrition and healing the body.
True.
Delivery, whether it's surgery or vaginal delivery, is a traumatic experience to the body, and you really should be getting proper nutrition, lots of protein, and who
Vitamin
has time?
C,
Who has time to do all of that and plan? And especially if you don't have a support system, you're really just kind of running on fumes and eating when you can. And so all of those pieces, that's for everyone.
Yeah.
We're not even talking about if you've had any complications, or there's your baby's in the NICU, or you have a sense of sadness because things didn't go as planned, or maybe you even had an infant death, or you didn't come home with your baby, which is really heavy to think about, but that's the reality. And so I think that's another piece that is oftentimes overlooked. For those moments that don't go as planned and things go wrong, you're still a healing postpartum mom. And so, it's time to have those conversations and time to start those discussions prior to delivery to prep.
Try to be as prepared as possible.
Absolutely.
I think, so what we're going to do right now is also focus kind of on the physical to start with. So again, we've just talked about pushing this human out of you or having this delivery. And so talking about mom first, what are the things that you think are to be addressed or are being addressed, have been addressed with mom? And I realize it's different whether or not we're talking about cesarean or VBAC, but in her recovery time frame or in that recovery period, she's going home and caring for herself. What are some things that if you had your best friend was having a baby, because I know it's good to probably be your best friend when they're having a baby, what are some things you would tell them in those initial, even first week for taking care of themselves?
Oh boy, really let out all the other things go. Just focus on yourself and the baby. And then I think that having those discussions of helping women be educated and make informed decisions about their own care, I think that it's important to raise awareness of the mental health aspect, of physical aspects, which I'll talk a little bit more about, but really just hitting those high points of things that aren't really discussed and for some reason seem taboo to even bring up or dismissed by a lot of other women or providers or just the community in general. It's just
definitely a hush thing, kind of.
It is, and
you're not enough of a mom. Or whatever it is, or weak, or all the above. Yeah,
and we even do it to ourselves. I mean, we may be feeling a certain way
because we just had a major and are in a major hormonal storm.
Yes, and so you want to seem like the strong one.
Yeah,
I can do this, and women have been doing this for years.
On Instagram.
So what's wrong? Yeah. So what's wrong with me?
Yeah.
But from the physical aspects, what I would want my best friend to know, and what I really try to teach and advocate is that there's major physical changes in the body after delivery. So we're talking everything from cardiovascular to pelvic floor. Obviously, is a big one. And, just the things to look for and to really...
In the immediate and the long term.
Yes. And to really be able to speak up to your provider and advocate for yourself. And if something doesn't feel right, it's probably not. Pelvic floor has long kind of been ignored. And
tell me about that before we talk about the subject. But when you're talking about the pelvic floor, like the health of the pelvic floor or the lack thereof at that point.
Yeah.
What are you talking about to the layperson, or even if there's a gentleman or a lady who's not had a baby?
So what most people are going to associate this with is this is a perfect example. So a lot of women who have had a baby, maybe when they laugh or sneeze or jump on the trampoline or run, they may have some leakage of urine. And
that's why they always wear black shorts.
Yes. And so, one of the things that for years it's like, oh, well, I pee on myself a little bit when I laugh, but it's just because I had a baby or I had a big baby.
Dismissed.
Again.
Like it's dismissed by others as a normal.
Yeah, exactly. And so while it's very, very common, it's not normal. And there are specialists out there, pelvic floor specialists through physical therapy that can help and rebuild those muscles. And
how soon does that usually start postpartum?
So we've really tried to push in the past couple of years to start that education piece inpatient with our vaginal deliveries, and especially those that may have a severe tear, severe damage to the pelvic floor. We start that education as an inpatient. So before they go home, we say, these are the things that are not normal. You're going to want to seek outpatient care if these things are occurring.
Which are?
Bladder leakage, pain with intercourse.
Bladder leakage like at the very beginning?
Usually within 6 weeks, everything should kind of resolve.
So 6 weeks, that's your 6 week post visit?
Yeah, you really kind of want to use that as your judgment. Now, if it's complete incontinence, that you need to
seek medical care. Like that's an emergency.
That's not normal. And you probably should start some therapy sooner. But you really want to start those conversations before people have babies so that they know what's normal, what's not. And we're talking even some pelvic floor help and physical therapy help prior to delivery, which you will see in the coming years. That this is going to be a more of a hot topic. It's already kind of starting to take off. But, with the typical, what we consider just part of pregnancy, the back pain, the hip pain, all of that, there's a lot of people that are already seeking physical therapy prior to delivery to help with some of that pain. And again, while it's common, it's not normal. And there are things that you can do to improve your quality of life and even regain your status of pre-birth, if you will, or pre-pregnancy. So I think that it's important just to even have that conversation and to know and have an awareness that there is help. And you don't have to live
accept
in
it
pain.
as the norm.
Yes, just because you had and you can start exercises even during pregnancy. And so, of course, just like any muscles, the more you use them and train them, the easier it is to regain that when you return. So there's a lot of benefit to delivery and then recovery if you have that awareness.
Do you think that ladies with the C-sections are at a better advantage for their pelvic floor compared to VBAC in most situations, or we really don't know?
Not necessarily. So with cesareans, you have a whole different set of problems.
But as far as the pelvic floor, similar, just the same?
Some of it's similar, just caused from pregnancy in general. Some may or may not have pushed for several hours before having to have a C-section. So there's that scenario. And then also scar tissue caused by their C-section scar. So if they don't start with that massage of the scar at 6 weeks, and
do they massage with anything in particular, or just any kind of oils or lotion at that point, because at 6 weeks your incision should be healed, but that's not something that's regularly talked about. And is it a deep massage? It's I would not definitely be the best person to explain that. But what we found is that it's hard to connect because at your 6 week appointment, you're not seeing a physical therapist, you're seeing an OB. And so that's not really their specialty. And so bridging that gap between those specialties and getting people the information they need has been very hard from just a operational standpoint. But that's definitely something that we discuss with our C-sections as an inpatient, but you obviously don't want them getting confused and doing that as soon as they get home. Because that'd be too early. Yes, and then there needs to be risk for infection and all of that. What are some things they can do in the very beginning as far as the pelvic floor? What should they avoid? And we're going to talk about a more typical situation, barring any other challenges going on. But they should wait until their 6 week visit to get clearance for most exercise, or
I would say for anything really using the abdominal muscles. But the earlier you can return to light exercise like walks, stuff that's very low impact and not using your abdomen definitely is good. To be fully cleared for exercise, yes, you would need to see your physician.
What about any of the binders or?
There's some support of that as far as just making patients more comfortable with that extra support when your abdominal muscles are weak. So, some physicians prefer it, and some, just kind of wait for the patient to ask. That's really more about comfort and just providing a little bit of extra support. Almost like when you tell a surgical patient to splint with a pillow, it'd be the same type of thing. With the C-section patients, really inpatient is focused again on education on what's normal and what's not and what to look for. But it's also about teaching them proper mobility and how to get in and out of bed. So if you think about in the hospital, you have this bed that raises up and down, right? It's so convenient. But when you get home, you're laying on a flat bed. So our physical therapists and staff really focus on how
physical therapists come up there inpatient?
Yeah. So we started that about 2 years ago.
Dang.
So one of the few in Georgia that does provide that. But like with all things, you have to really triage, who would need that education the most. And so we really started our focus with C-sections, and then those that had severe tears or other issues when you have those severe tears, you're at a higher risk. So having those conversations.
No, Gentry. I don't know. I'm at a higher risk of what?
Yes. So you're going to be at a higher risk of having the pelvic floor dysfunction. So we have physical therapy. Come and see the C-sections, help with mobility, show them how to get out of the bed properly when they get home from a flat lying bed, really how to avoid using those abdominal muscles when they're taking care of their infant. Because if you think about it, what other major surgery? You got hips, knees, shoulders. You're going to have physical therapy. So why have we always thought it's okay to cut open a woman's abdomen and say, oh, here's a baby to take care of, but we're not going to
you do a laparoscopic gallbladder and you're not supposed to be holding a baby.
Yeah.
But you push the human out, or they cut your abdominal muscles, or you've been trying to push for a number of hours, and then they cut your abdominal muscles. But here, care for the baby. Hope your mind works too.
Breastfeed while you're at it.
And try to feed the human.
Yeah, all the things. So we're really trying to look at the postpartum period differently, and how can we set moms up to have the support they need, to have the knowledge to heal, and to make it less painful.
You had mentioned painful sex. So these folks, they come back for their 6 weeks visit. They might be getting pressure from the partner. And then OB says, you're released or you're not released. And how long would it be normal to expect to have painful sex? And then what is it a problem with scarring and all the other things that can happen?
I think that each patient is individual, and so obviously the first time you have sexual intercourse after you have a vaginal birth, it's going to be a little bit uncomfortable.
Put lightly.
Yeah, a little bit uncomfortable. So that's to be expected. But if you're talking weeks out and several times of intercourse later, and you're still having
weeks
pain,
out being how long after? Because we're post 6 weeks.
Yeah, I mean, I don't know that there's a definite time frame, but if you're having intercourse on a regular basis and it's painful and it's not enjoyable, you need to see your physician. And, need to be evaluated to see if there's something going on.
And if you're breastfeeding, someone should inform you that it's a little like you're menopausal.
Yes,
for that area.
It can be, yeah.
So you may or may not need some extra lubricant.
Yes.
During that period of time.
Definitely an important side note there.
Real important.
Yes, because that definitely can make it more painful if you're having any issues.
Yes. So on the physical, we had spoken a little bit more about some focus more recently on the cardiovascular risks that are affecting women in that postpartum. But you're mentioning even up to a year they're looking at and following women. And I'm so ignorant to that aspect. When they say the cardiovascular risks or what they're assessing right now, tell me more about that, because I think I went, really? And I do think about the high volume of fluid that women have during pregnancy, which I would imagine is putting
and the
pressure on the heart.
Shift in general. If you think about the blood loss and the just the internal shift of fluids, you're used to supporting this baby. You have the baby. You lose a lot of fluids during delivery, blood loss. Your body's trying to recoup all of that. So, we're really currently working on a cardiovascular risk assessment that will follow patients, inpatient and outpatient.
So is this primarily talking about ladies who have had cardiovascular risks? So the heart is what we're talking about. Risks going into pregnancy, or all ladies, or?
Pretty much. So this risk assessment tool is currently what we are building to really focus on those risk factors. So obvious ones like high blood pressure, diabetes, obesity, any prior history of cardiovascular disease. And so really focusing on all aspects that touch those patients during pregnancy or even outpatient up to a year. So we're talking about a patient that delivered, let's say in January, but goes to the ER in October. She should still be getting that risk assessment. in the emergency room.
And this is a standard that's already been made, or they're currently making it?
We are currently making it, and
Okay.
And pretty much going to roll it out soon. So,
so providers, this would be for you, is kind of a newer thinking, is still thinking of them in that postpartum period, as of right now, thinking up to a year.
Yeah, because
really.
Historically, what most people think is, oh, once the baby is delivered, the patient's healed. Whatever issue they were having, it's probably gone.
Because you've grown a human for 9 months, so now you must just be better.
The baby's out, so your blood pressure.
I think the thinking sometimes is that whole, you go 6 weeks postpartum, or, you're going to go to the OBGYN, you're getting your clearance for everything.
Yeah.
And kind of like it's over. And I think that...
Congrats, you're done.
Yeah.
No, that's
it's
not the finish line at all.
The rest of your life.
Yeah.
Just kidding.
Yeah, but I think, the cardiovascular piece is something that's, currently evolving. And so
Interesting.
There will be a lot more information coming out, nationwide really on that. And it's something that all OB groups and OB service lines and hospitals are really trying to grasp. It's a huge initiative, and it will really take everyone in the community, every healthcare provider, to really capture those assessments and recognize and acknowledge when they score high on that risk assessment that there might be an issue.
And they may
Don't
even look
dismiss
very
them.
healthy in front of you.
Absolutely. Don't dismiss it.
Because it is a lot to go through. So it's interesting, and that's cool to be on the kind of the front end of knowing things that are coming, and that they're taking this period of time more seriously than we have in the past. I want to focus on another physical part before we get into mental and then social. But physical, because we'd like to talk about those breasts that have now grown.
Yes.
They're supposed to, I say they're supposed to feed the baby, milk has come in, whether or not someone chooses to feed the child or not. But tell me about these breasts.
Yes. So if you choose to breastfeed your child, that comes with more so pressure from ourselves. And from society of, quote unquote, everything going perfect. Breastfeeding is rarely perfect. It's can be very difficult and
painful as shit.
Painful. And, sometimes requires a lot of support, a lot of reinforcement, a lot of education. And even if you take all the classes and you do all the things, that doesn't mean that it's going to go perfectly. Usually it takes a good month to really get things established, because you think you have the baby latched, everything's going great, everybody's doing wonderful, and then bam, your milk comes in, the baby seems to be drowning at the breast, and you're swollen and tender, and you're like, oh my goodness, what do I do with these things? And they hurt, and you're just miserable, and you think
you're not
is it really
sleeping.
worth it? Yeah, you're leaking
and you
everywhere.
feel fat.
Yeah. So you're starving and you're thirsty,
and you're caped to be Wonder Woman hasn't come in.
Yeah, all the things. So if you choose to breastfeed, I think the main thing to know is that while it is a natural thing, it takes some perseverance sometimes, and that's okay. And it's okay if you try really hard and it doesn't work out for you.
Yeah.
It's okay. We have things that you can use as a backup. I'm so pro breastfeeding, so don't get me wrong on that.
It can be more convenient and not too.
Yeah.
I say
it's
that.
Definitely a money
I'm like,
saver.
it's convenient when you're in front of them.
Yeah.
Inconvenient if you're working and you're away.
Yes.
But like you said, a money saver.
Yeah, for sure. And from all evidence, it is best. I mean, there are risks.
Breast is best.
And that is
when
very
possible.
True. Yeah. You're really looking at
Cheeky.
Benefits for the baby forever.
Yeah.
Even if you breastfeed, you're less likely to get breast cancer. You're less likely to get diabetes. I mean, there's so many benefits for both you and the baby. So it's definitely worth a try, and just know that you may need some extra support. And if you're not successful, that's okay too. And baby's still going to be okay if it has to drink formula.
Because we live in America.
Yes. Everything's going to be, it's going to be okay. We want to help you reach your goals and support you in that. But, at the end of the day, I think we put the most pressure on ourselves.
Amen. Yeah.
And sometimes it just doesn't work out. And so sometimes you got to look at that mental health aspect of, am I stressing myself out too much about breastfeeding, you got to really weigh the benefits first the risk of driving yourself in, crazy.
Do you have any other thoughts on the physical aspect for the mom before we kind of get on to mental health and then some social things in America and the expectation of getting back to work and things like that? But anything more physical, pearls that you think of? And the reason why I bring this up partly is I think if you group about 10 women together and you talk to them about their, whether it was, when we say inpatient, that's while you're still in the hospital experience, and then when you're leaving, the guidance can be different from different OBGYNs for a variety of reasons. Some can be their training. Some can be what time did somebody come by around? What other things are they having to focus on for you? If you've got a heart thing going on, that might become
the priority.
The issue. Yeah, that's a priority, and it should be. But maybe something else gets left off. And it sounds silly, but is there any kind of pads or creams or soaks or not soaks?
I think the golden takeaway is you get all of the information you need from your nurses at discharge, and it is packed in a nice
envelope.
It's packed in a book, and
okay, good.
Literally got everything that it does. It really answers any question that you could have. So I would just really suggest that you rely on other moms that have been through it, that you're close to and can really open up to and ask.
Hopefully you have somebody that you can trust, or there's Google.
No, don't Google.
Okay. Don't Google. She's acting like people got all kinds of friends like her. And you know what she has? A bunch of other maternity working friends. So who are they really supposed to contact?
But really, any friend that has had a baby, they're going to have, key takeaways that this worked for me, or, oh yeah, I felt like that. It's normal. You're not alone. I think that's the key, is not feeling like you're asking a stupid question or you're not alone. And any mom that's had a baby that somebody else asked them, they're not going to act like you're stupid. Any of those questions are legit. But yeah, so you really get all of that information you need. And, if you have any questions, you can always call back up to the hospital from where you were discharged.
Oh, really?
Oh, absolutely. Okay. You can call your provider. And even if you call the hospital and it's a more complex issue, then they can answer. If it's just, simple advice or something you forgot, they can direct you. But otherwise, they'll say, you might want to call your provider for that. So if you're ever just feeling lost, call back to where you just left. They will redirect you and help you. I think that everyone that's in this line of work really has a passion for making sure their
if you're in that, for sure,
that their patients
are pediatrics.
Yeah. We really truly do love it. I want patients to know about options and things that are normal and are not, and things that have been accepted in the past that we really need to bring to the forefront and have discussions about. And so I really think that we covered all of the physical pieces, but never be afraid to reach out and ask a question. And no, it's really not a stupid question.
Nothing is. We're not supposed to know.
Absolutely.
If we're the laymen over here.
And even if you've had 3 or 4 babies, as you age and things get different and your body goes through that multiple times, you may experience something that you didn't with your first, and that's okay. You need to ask.
Now, kind of abandoning the physical, and really all these things tie together, but talking about the mental health of our moms postpartum. Oh, it's something that was not addressed for a long time, starting to be addressed, but we have a long way to go. And all the things, tell me. What do you see happening? What are the concerns? We talked about a woman who's gone through pregnancy and now they've delivered. And even in the perfect case scenario with the delivery, there's always things.
Yes.
What do you see needs to be done to support moms?
Yeah. So, boy, this could be a whole episode in itself. But the amount of stigma around mental health in general, we know is an issue. And then we also know that patients that have just had a baby, it's even more underreported, because let's be honest, who wants to have a baby and then say, you know what, I don't really feel mentally stable right now, but don't take my baby. So, and I need help, but by the way, you can't get an appointment for 6 months. Like,
I need help, but I don't know how to ask.
Yes.
I don't know if I need help.
And then the access isn't really there because
I'm so tired it's difficult to get to the appointment.
Well, and access in America is an issue anyway.
And when you say access, you mean not having enough providers.
Access to providers, access to appointments. So in our community, we're doing a lot of work around how do we prioritize
and who's responsible? What provider do they go to?
Yeah, for years, our OB patients have really been caught in this circle. And I have seen a shift because of recent work in our community. But I do think that traditionally these patients get stuck because OB doesn't really know how to manage psych issues, and psych doesn't really want to touch an OB patient. Yeah. And so they just kind of get circled around and around with no real resolve and just kind of get stuck. And so again, I do feel like in our community, we're starting to see a shift in really bridging that gap and specialties working together and trying to prioritize appointments for postpartum patients. And number one is getting the patients to come forward in the first place to say, something just doesn't seem right and I need some help. That starts with the community. Being willing to recognize it, come forth, feel safe, feel understood, feel heard. And historically, we've just not done a very good job of that at all.
Yeah, I think you were speaking of, so you've gone through this period of time where you've been pregnant. You've now delivered a child. You're trying to come back and do all the things. To me, even without having a young child, any of us that are fatigued enough, it tends to put the mind in a little bit of a disarray. But now you add a little baby to it. And like you said, it's hard to admit, or not even admit, but you don't know it's normal, especially if it's your first one. And even if it's your second, your third, your fourth, they can all be different. Mm-hmm. So,
and you come to expect with a huge hormone shift that you're going to have some baby blues. You're going to be tearful. You're going to, have some days of crying right after delivery and not really being able to explain why. And all of that is really normal. But when you hit that 2-week mark, if you're still crying every day and not wanting to eat and not wanting to drink and just kind of staring at your baby like, I love you, but I just don't have the energy, that's something that you need to have a discussion about.
For the sake of this episode on Make Me Pretty podcast, would you suggest their first call be really to their OB?
Absolutely.
Boy, the OBs, they have a lot of responsibility.
Yeah, absolutely.
But at least that's a starting point.
Yeah, and I do think that they are doing a better job of recognizing and acknowledging it and trying to get their patients the help that they need and not making them feel shameful or dismissed. And so I think that that's definitely the place they need to start. Because if they're still within that postpartum period, they really need to be following up with their OB for any of those needs.
That's good to know.
Unless their OB has directed them elsewhere.
But at least that's a starting point.
Yeah. And, some patients are already established with a therapist
which that to me, it seems like would be the best of scenarios.
Yeah, absolutely.
If you had something that was established, you're already a patient or a client.
Those patients definitely typically get in quicker than a non-established patient that's having issues.
I would think in some ways it'd be nice to go ahead and have
a therapist.
Yeah. I mean, you need your therapist ahead of time. And then afterwards I would go ahead and have an appointment just to make sure you got one.
Yeah. I mean, in an ideal world, it'd be fantastic to have a therapist on speed dial, already. But, I definitely don't want to sound doom and gloom like every patient is going to have mental health issues.
No, well, yeah, I think but like you said, it's a lot on people. And noticing the difference between the need to cheer folks on and cheer ourselves on versus saying, okay, I think I need a little bit more support. And realistically, in the perfect case scenario, I think folks need support. My hope is for folks to have enough support that people would recognize that with the person and not assuming that the woman is supposed to. But as we've discussed, we don't really treat it that way in our society. Interestingly enough, a lot of societies, a lot of countries that are even under, but not to the level of the United States. There's often, whether it's through tradition, but families coming together to support this whole event.
Absolutely.
And I know I've heard about it in certain South American cultures. Of course, sometimes it means a lady staying in the bed, which I'm a little worried about that.
Yeah.
like, get out of bed. But too much help, Yeah. But in reality, how can you have so many societies that are even tougher? What people are dealing with is so much more than what we're dealing with, and yet they get it.
Yeah.
Whether it's even a ritual, they made it into a ritual maybe. But to expect women to get back to all of their house duties, I say their house
Or
duties, so
work.
I'm going to be careful. But to
All
get
of
back
it. I mean, not
to
any,
caring for a
all the
home,
things,
caring for children, you need to try to find somewhere to sleep. You need to maybe try to...
But don't forget self-care, because you need some self-care too.
Yeah.
But then you also need to...
I should have been born in a different generation.
I mean, there's all these things that, it's kind of like the social media joke of like, I'm trying to, eat right, be a good friend, work 40 hours a week.
Hop on one foot, smile at the same time.
Best mom.
Perfect hair.
Classroom
lipstick,
mom and all the things.
Get that Botox.
Just kidding. I mean, all the things.
All the things.
Like, it's impossible.
It's impossible. It's impossible.
Why do we set ourselves up for these, unattainable
and who's setting the expectation?
We do it to each other.
Yeah. Moms too, or just everyone?
I think that, I don't know that it's intentional, but I think that, especially with social media, it's like everything comes across as so perfect. And so we put so much pressure on ourselves to meet all these standards when you really should just give yourself some grace and do the best you can.
Yeah.
And know when you're at your limit and you can raise that flag and say, I can't do anymore.
Or, I got a suggestion for those who are probably not listening is, I don't know, give them some help, I definitely see some individuals that are at a higher risk for not asking for help.
Oh, absolutely.
To me, sometimes it's the person that's looking like they're handling it just fine.
Oh, absolutely.
Who's
crying behind closed doors.
Yeah. And saying, it's fine, everything's going to be fine.
And listen, we're like, and I say this with like true honesty, even knowing coworkers that I've had in the maternity world who teach this to their patients every day, right? It's okay to ask for help. It's okay to not be able to do everything. They also have a hard time.
Because it's hard to ask
I
for
need help. Yeah. I'm not okay.
It's feeling like you're failing at something. And the expectations of doing all the things.
Yes.
And then we spoke about returning to work, but I returned to work at 4 weeks with the idea that I could do 4 days the following 2 weeks. And we were doing surgery, all the things that I was trying to pump. Y'all, it wasn't just hard. It was virtually impossible. And I didn't already have other kids. And it's hard to say that now, and she's 14. I don't know about the rest of y'all. I was like, I can do this.
And flip side with me, with my first child, I had went back to school and had started as an LPN and went back to get my RN, and was towards the end of my program when I had him.
I cannot imagine trying to study on that kind of brain.
Study wasn't even my issue. It was having a cervical laceration that was very severe, and then having to go back to clinicals 2 weeks later, which was like work. I couldn't sit or stand for more than 30 minutes at a time without feeling like my insides were falling out. But what do? We just push through.
Yeah.
You're fine. You're going to be fine. You can do anything for the short period of time. Yeah. You just do it. And reflecting back, like, that was terrible.
Yeah.
It was horrible.
Yeah.
I did not allow myself to heal. I probably needed a blood transfusion. Like, it was terrible. And so if you can avoid doing that, stop putting so much pressure on yourself and just take a minute.
I work at a plastic surgery group because it's Baby Pretty podcast. I would go in there and try to pump with the in a cold bathroom, but please relax so my milk will let down. But I need to hurry back to work because there's patients waiting, right?
Yeah, absolutely.
All of the things. Now you got to make sure that you got enough, that milk's got to stay cold. And the pressure that women put on themselves about what food they've eaten. Now, Gentry, you might feel differently, but my opinion, if that baby's crying, it's probably not all just the garlic and the caffeine and whatever. It'll be fine. Okay? It'll be fine. Quit thinking about that. That's bullshit. I mean, I'm sorry.
As long as you're eating, I think it's important to
you have to eat. I had the opposite problem.
Yeah.
I had the opposite. I don't even know if it was a problem, but because you're burning so many calories. You got to eat in order to produce the milk for sure.
About 500 extra calories.
Oh, yeah, it's an awesome time frame. Yeah. You could lose weight while eating extra and drinking a gallon of water. Yeah. And we talked about in America, there's not grace. But if anybody's ever had a friend that lives in California and works for Google or Pixar or any of those lovely, because that's usually maternity and paternity. So awesome.
Yeah.
I mean, I don't know if they're going to be able to support that forever, but the truth is in maternity, there needs to be a period of time of personal self-healing.
So the healing part is an issue all in itself,
Yeah.
right? If you think about that, this impacts this child's life
Forever.
That period of bonding
Yeah.
and proper nutrition and rest and socialization and interaction with the parent.
Well, the mom's health for
All of
themselves,
it.
which affects the child too. Yeah.
Absolutely, all of it. I mean, we're talking about years and years of impact, if not forever, if you take that away from the mom and baby dyad. Like that is a major issue and probably a root of a lot of problems we have in America is that we do not honor and support that mother and child dyad that really needs to solidify from the beginning. We're already, as soon as the baby's out, thinking about how quickly we can separate
Get back
that
to
mom.
the stuff. Yeah.
It's an issue. And it leads to all the things. Terrible healing, terrible bonding, mental health issues. I mean, it's a very big problem.
It is exciting to hear that there are things being acknowledged, addressed, and plans to make changes, and realizing that all changes take time. And I know at least myself is appreciative that we have advocates like yourself. Well, I know recently you had presented at
AONL
with Catherine Casper, who is a physical therapist.
Yep, she's the manager of acute rehab, talking about the 4th trimester and ways that we are really crossing specialties to make it easier on mom after discharge.
It's just awesome because, like Gentry has said, as a mom, you can control mom to child. And just saying that that's important. I think for a long period of time, we've been a little bit about almighty woman, hear me roar.
You just do it.
Yeah.
You can do it.
It's been a real cool thing to say, do it, I can do it, I can do it. And I don't know about the rest of you guys, but
I'm tired.
I'm tired.
I'm gonna
can
sit
do
over
it,
here and let
but I'd
somebody
like
do my dishes.
I'd like help.
At some point, we have to stop being superwoman and realize that we're actually just hurting ourselves.
This has been awesome. Without pregnancy and postpartum, none of us would be here, right?
Yeah.
So bless you to the OBGYNs and pediatricians and to the Gentrys
all of their
who take
supportive staff.
and all their support, all of their supportive staff. But again, thanks, Gentry, for joining us today, giving us information. And it's exciting to see things that are being addressed, things that are looking to be changed, and all of those things happening in the next several years, hopefully, and over time. And maybe we'll get you back for something different in the future.
Yeah, about all of the wonderful changes that we've made.
Amen.